I was diagnosed with the condition at the age of 52, that's some 20 years ago.
And how does that affect your life day to day?
It really doesn't affect us. I think I manage it quite well. Obviously, over the years, the medication has increased a little bit. I've tried to keep myself active by way of exercise and trying to control my diet. Sometimes have a battle along the way, but in the main, it's by controlling my diet.
And do you see a change in care from when you were initially a medical assistance?
Well, I actually joined the charity within months of being diagnosed because I wanted to give something back. There was certainly a change in the treatment of diabetes. The drugs have improved, obviously. The technology, even for those with type 2 diabetes, has been introduced in limited circumstances. I think there's a better understanding within the public, although that could be improved. There's certainly a lot of room for improvement in that area, understanding the difference in the types of diabetes that exist. But generally speaking, technology moves on. The development of different type of treatments are there to support individuals now that perhaps 20 years ago there wasn't.
You mentioned there about the education of people. Do you think there's stigma attached if you say you're a type 2 diabetic?
I definitely think so, and that's where the charity perhaps needs to do a little bit more to support those with diabetes, because there are distinctions in the various types that there are. In respect of type 2 diabetes, one can get it hereditary. For example, on my mother's side of the family, there was a lot of type 2 diabetes. Looking after yourself, making sure you eat sensibly, you drink sensibly. You can start getting indications that you could be going down that path to eventually be diagnosed with type 2 diabetes. And if you keep yourself well informed, you can do a lot to help yourself, either by deferring the onset of the condition or keeping away from it completely.
There's a lot of talk in the press recently regards childhood obesity and links to say that the next generations coming through could be at high risk of type 2 diabetes. And you mentioned there about lifestyle choices, exercise and food. Is that something you think that everybody should consider?
Well, I think so. If you believe that you could be prone to getting diabetes, I think you need to take a conscious decision before the signals are fairly evident. So that on the prevention side, there is a lot that you can do, at least to defer the onset of the condition. But for many people, they haven't got the time or the inclination to do so. The age of people now getting type 2 diabetes, where it was always regarded was a condition that the onset of which was much later on in life. The National Health Service has recently published information that the onset of diabetes, or type 2 diabetes, is now getting fairly prominent, and there's been a dramatic increase in the number of, or in the percentage of people diagnosed with type 2 diabetes much earlier in life, under 40 years of age. We are currently working with both public health and with health from a charity perspective, that is, to do more work in the prevention area, the prevention of type 2 diabetes. Obviously, in regard to type 1 diabetes, there's nothing that can be done to stop the onset of it. It's a completely different type of condition.